Today we're launching a study in relation to the health behaviours of Irish children, and I want to thank colleagues in NUI Galway who've carried out this very extensive survey. More than 15,000 children in over 255 schools right across the country were surveyed in relation to their attitudes towards health and in relation to their own personal health. And I'm very pleased to report some positive findings. We've seen a reduction in the number of children smoking, we've seen a reduction in the number of children taking alcohol, we've seen a reduction in the number of children using soft drinks and eating sweets as well. Of course, in any survey there are areas in which we need to improve, and I do think there are some significant areas of concern in relation to vaping. Whilst we've seen fewer children now actually smoking, we've seen more and more people now actually taking up vaping, and 22% of the children surveyed saying that they had tried vaping. So that's why I intend to move forward now with our legislation to ban the sale of e-cigarettes to children under the age of 18 in our country.
There's also really important reductions actually in sweets and soft drink use in children. I was looking at the soft drink data, that was nearly halved. Unfortunately though, we haven't got an improvement in fruit and veg intake, so more work is required there, and it really looks like there's a social class pattern there where children from richer families, from higher social class backgrounds are more likely to have fruit and veg in their diet multiple times a day than children from poorer areas and living in poorer families. Bullying, traditional bullying, the face-to-face type, that's more common in younger children, but the cyberbullying, which is a lot lower than the traditional bullying, which is a little bit counterintuitive. The cyberbullying is more prevalent in older children, and it's the older girls, the 15 to 17-year-old girls, who appear to be most victimised by cyberbullying.
One of the things that I would say jumped out from the study was clear about life satisfaction with children. That children live in more higher social class communities, areas, had a better life satisfaction indicator of 75%, and those living in poorer communities fell short of that. And I think there's a significant amount of work that needs to be done there. If children aren't happy, they don't feel loved, they don't feel well looked after, then I think that leads to other health problems down the road.